So one of the things that I think about anytime I see a patient with acid reflux is first and foremost to make sure that I really believe that what I'm hearing is truly acid reflux. Because acid reflux, by definition almost, is a symptom that occurs in the chest. And even as gastroenterologists, we almost have to think first about the possibility that this is not an esophagus symptom, but may in fact be a cardiac symptom. In my experience over the past 20 years, I can remember those circumstances when patients were referred to me for acid reflux, and in fact what they had was coronary artery disease, and they had very serious blockages in their coronary arteries. So it's very important, even as a gastroenterologist, to make that distinction that we're truly talking about acid reflux. Once we feel comfortable that we're talking about acid reflux, we have to think about a few things. First and foremost, is this, if you will, simple acid reflux where the patient does not have any worrisome or alarming features. Alarming features would include painful swallowing, difficulty swallowing where the food is getting caught or stuck when they swallow, symptoms perhaps that are not responding appropriately to medication might raise concern, and then of course weight loss or any vomiting and vomiting of blood. These would be indications that something more serious may be going on. If those more serious symptoms are not going on, then acid reflux can be treated fairly well with a whole host of very effective medications, very safe medications that we have. Some patients, however, are appropriate for endoscopy even if their acid reflux is very well controlled and if they're not having any of those worrisome symptoms. And those patients might include patients who we're worried, based on their demographic and their personal history, that they could have developed precancerous changes in the esophagus. So we worry about this mostly in white men who are over age 40 or 45, who have had acid reflux problems for at least 5 years, and if they have other risk factors, like they have excess weight, for example, or if they have a family history of precancerous or cancerous conditions of the esophagus. Those patients, even if their acid reflux is well controlled, I often will recommend that we do a one-time upper endoscopy to make sure that they've not developed precancerous changes of the esophagus.